before you all started this program and I had had my heart attack, I would not be sitting here talking to you today. I would not have survived the helicopter ride to St. Louis.
It's a privilege to be here. It really is to, go to the grocery store and somebody thanks you for saving their life. And you do it all the time and you don't really think about it, but you take care of people and you've touched them and they remember you for the rest of their lives.
They put their faith in us. They trust us. That's an incredible responsibility.
I see patients come in here and the fight, the will that they have to live, everything that they've gone through, and how they can still sit there with a smile on their face and they're still here, they're still fighting, and they thank you for your care.
The team is fabulous. They're the best. I mean, I could not do this without them. Surgery here is a joy. It's the best part of my job, is being in that operating room. And without those guys, I wouldn't be able to do it. It makes my day.
The team, the heart team, the surgeons, the cardiologists, the ER nurses, the cardiac cath nurses, the hospital nurses, everybody, they are amazing and they make this enormous difference, and sometimes they only see 5 minutes of it. And it's huge that you can spend 5 minutes with a patient and save their life.
As a young nurse, when you had a cardiac patient, you brought them in, you took care of their symptoms, you put them to bed, you gave them oxygen, nitro, and morphine, and you waited. And at the end of their evolution of the process, what you got was what you got. And now here, when they hit the doors of Heron Hospital, the machine starts. And within a time period of a few hours, these people go from having symptoms to having their problem corrected. That's amazing.
That goes to say that if you've got your heart in it, you can do it no matter where you are.
I mean, honestly, this is a pretty high-tense, high-pressure job, and everybody's come. No one's quit. Everybody's is here every day, and everybody knows their job. And everybody is very good at their job.
I'm blown away by all the stuff that they do. They make it look so easy. To be here with them and working with them, it's an honor.
We're not just one team that works together to help our patients, but we're a family treating our family members.
My father, who is a heart patient also, has had 2 heart attacks. And the last one that he had, I happened to be here. And had we not instituted some of the things that we've done, he may not have made it.
I think from administration down, everybody works as a team. Everybody has the patient as their focus, and no matter what we need to do to make it to our goal, SIH has always been wonderful to back us and work with us to get where we need to go for the patient as a team.
We would not be here today if we were not supported, and they have been very helpful in giving us the opportunity to expand and to continue to grow. The support from the community is also very strong. And we would not be able to do this on our own.
I had numerous offers across the nation, from East Coast, the Chicago area, down in Texas. I came to Southern Illinois Healthcare because through my 2 or 3 days of interviewing, everybody got it. Everybody was committed to it. They had a passion for the program. There was no holes or gaps that I could see that people didn't understand it or buy into it.
When I came here in 1991 as a resident emergency medicine from Cleveland, Ohio, I never dreamed we'd be doing heart surgery here at Carbondale. Basically, the program has brought the city to us.
It has been a big success. The success has really affected the whole region. So that's one of the biggest benefits and satisfactions. This is something that is not just in one local area, but really expanding into all the other hospitals, even outside of the system. And getting the appreciation from the people that really makes it so worth it.
The difference between us and St. Louis, you become a number up there. Down here, you're still an individual.
Our clinical outcomes here match those of the larger hospitals in big cities. And the patients in this area don't have to leave to have surgery. They can stay here with their family members.
People that say, oh, I'm going to go here to have this done, or I'm going to go here to have that done, there's no sense in it. We have everything to offer here that they have elsewhere. The most consoling thing that we've got is you are home. Your friends, your family are here to support you.
Those 2 a.m. wake-up calls that you know that you're coming in to save a life, and then you actually do, and 1 minute the patient's on the table and their life is literally in your hands, and within seconds you've literally saved their life. I mean, that's about as rewarding as it gets, I think, in healthcare.
Now it is something that that I have always wanted to be a part of, and I'm proud that I'm a part of such a place.
There's distractions everywhere, and yet we get things done. To have a heart attack is a distraction in a person's life, and yet they come here, and we send them home. That's an amazing thing.
We give it everything we have here, and with the team we have here, they get the best shot that they can get, I think, and that's the real satisfaction in this job is seeing people get over their surgery, seeing them get up and walk and go out and enjoy life again.
The thing that really gets me going is being able to come in here and do what I do every day. I love what we do.
You treat cancer, it takes a long time to see the results. Pneumonia or an infection takes weeks, but with a heart attack, you could come in and the next day you are a different person, you're better. So it's almost instantaneous feedback.
I see the dedication. I see the calling. I understand that it's about people. It's not about them. It's about somebody else. And to know that those people every day give that much. I don't know that you can find a word to describe. Just, hero probably doesn't even cover it. They're above that.
Thank you for 10 years. Don't lose that passion and commitment to the program. Keep it going forward. We just scratched the surface of what we can do. 10 years is nothing, and I want to live 100 years to take care of all these patients, so keep going.
Oh, I think they're all doing a wonderful job. If I needed surgery, I would stay here and have my surgery.
Congratulations on 10 years of heart.